Your lab staff works hard every single day. But when workflows rely on manual entry, faxed requisitions, and disconnected systems, delays become unavoidable. And in healthcare, delays affect everything. One faxed requisition, one typo, one missing order, one delayed result. That's all it takes to create workflow disruptions that impact physicians, staff efficiency, and patient care. Modern healthcare organizations need laboratory systems that move information instantly, accurately, and securely. But outdated ordering processes slow everything down behind the scenes. Optimizing your laboratory information system, or LIS, transforms disconnected workflows into intelligent, automated operations. Instead of chasing paperwork, your team gains real-time visibility, automation, and seamless interoperability. An LIS lab ordering system connects providers, laboratories, analyzers, and healthcare systems into one connected workflow. It manages the entire journey, from test order to specimen collection to result delivery. And when optimized correctly, it eliminates unnecessary delays and manual work across the organization. In many organizations, the process still looks like this. A physician places an order, someone prints it, someone faxes it, someone manually enters it again, and every handoff creates another opportunity for delays and errors. When laboratory systems rely on manual processes, the impact spreads across the entire organization. More delays, more administrative burden, more opportunities for errors. Teams spend valuable time managing paperwork instead of focusing on patient care and operational efficiency. And as testing volumes continue to grow, those inefficiencies become harder and more expensive to manage.
A modern LIS replaces manual processes with automated digital workflows. Orders move instantly, specimens are tracked automatically, results are delivered directly into EMR systems, and your staff spends less time managing paperwork and more time delivering care.
Orders move instantly between systems. Specimens are tracked in real time. Results flow directly into provider workflows without delays, printing, or manual follow-up. Instead of disconnected processes slowing your team down, everything becomes faster, more visible, and easier to manage across the entire laboratory operation. Optimization starts with visibility. Map every step from order entry to result delivery. Identify where delays happen, where are staff wasting time, where are errors being introduced. You can't improve what you can't clearly see.
Your staff shouldn't have to spend hours re-entering orders, chasing paperwork, or fixing workflow gaps created by disconnected systems. But in many labs, that's still happening every day. And over time, those small inefficiencies become major operational problems that impact turnaround times, productivity, and patient care.
Automation removes the tasks your staff should not still be doing manually. Electronic order management, automated specimen routing, barcode tracking, integrated analyzer workflows. Automation improves speed, accuracy, and consistency across the entire lab operation.
It's about empowering skilled healthcare professionals to focus on higher value work instead of repetitive administrative tasks. Your team becomes more efficient because technology handles the manual bottlenecks, slowing them down.
Modern laboratories already have the data they need. The challenge is visibility. With real-time analytics, organizations can see where delays happen, where workflows slow down, and where operational improvements can be made immediately. Because when leaders can clearly see what's happening across the lab, they can make smarter decisions faster. Instead of reacting to problems after they happen, optimized laboratories can proactively identify trends and resolve issues before they impact patient care. That's the power of intelligent healthcare connectivity.
Technology alone doesn't create transformation. Continuous improvement does. The most successful healthcare organizations consistently evaluate workflows, gather staff feedback, and adapt processes as healthcare evolves.
Optimizing laboratory workflows isn't just about moving faster. It's about creating a healthcare system that works better for everyone connected to it. Less administrative burden for staff, better visibility for providers, faster answers for patients, and a stronger operational foundation for the future of healthcare. Healthcare organizations can no longer rely on disconnected systems and outdated workflows. Modern interoperability and automation are no longer optional. They are essential for scalable, efficient healthcare delivery.
At Lifepoint Informatics, we help healthcare organizations modernize laboratory operations through interoperability, automation, and intelligent data exchange solutions, helping labs reduce inefficiencies, improve visibility, and deliver faster, more connected care.
Thanks for watching. Subscribe for more insights on healthcare interoperability, laboratory optimization, and digital transformation in healthcare.